All right, Nigerians spend so much on medical tourism. Not only that, maternal and infant mortality ratio still remains quite high, not to mention the poor state of infrastructure of many government-owned hospitals and care centers across the country. These are only a few of the challenges facing Nigeria's health sector. It is only a question of time before Nigerians get a new health minister, and setting the agenda for whoever the candidate will be could help highlight areas of priority, begging for urgent attention within the health sector. That's the crux of our next discussion. Joining us in the studio to talk on this, as well as other issues around it, is Dr. Rasheed Abati, Chief Medical Director, Heritage Men's Clinic. It's nice to have you join us, Dr.
My
Abati.
pleasure. My pleasure.
Good morning. Welcome.
Thank you
Great.
so much.
All right. Now, we have often known that when it comes to the health sector in Nigeria, we talk about the inadequacies in so many areas because government has not been consistently investing, especially when it comes to budgetary allocation, when you talk of attracting the private sector to participate intentionally. We've not seen all of those. And that was why during the COVID, there were projections that, in Africa, Nigeria inclusive, people were going to drop dead on the streets. It was going to be because the health infrastructure, the health system is very weak and so on. Of course, we didn't see that happen in that context. Of course, that is not to say there wasn't the impact of COVID, but someone said recently that the way Nigerians navigate health, it looks like there's a miracle around it, because if you want to juxtapose it against the reality, things should have been worse. Speak to us from this window.
Absolutely. And talking about the COVID, I think we actually dodged a big bullet. But the reality on the ground is we're really far behind the 8 ball when it comes to healthcare, infrastructure development, and even the other variables. Recently, we've been seeing a lot of exodus of Nigerian doctors. That is a major one. Even in the US, we don't have enough doctors. So not to talk of Nigeria, where our population actually exceeded the number. If you look at the ratio of Nigerian doctors to patients, it's overwhelming. It's not sustainable. But the bigger part of your point is we've been lacking in terms of how much our government has even been helping. But I'm from the opinion where, I'm based in the US. I think the government needs to provide a fertile ground for private investment. It's not sustainable to even expect our government to be the only one to carry this load. Because we're talking, let's take Lagos, for example. Lagos is exceeding 20 million. We don't have enough hospitals. Washington, D.C., as an example, if we can use that, we're less than 740,000 people. We have 7 major hospitals, and we said it's not enough. They just built the 8th one. And we're talking the lack of hospitals where anything can be done. So the kind of load we have here begs that we need another approach. We need a situation where the government can make it friendly for private investors to come in and augment what the government is already doing or not doing. Because once the private investment comes in, the free market will help. Healthcare is something we all need. You alluded to how much money we spend in terms of medical tourism. Medical tourism, as at now, we spend excess of $2 billion. That is dollars we don't have. And guess what? We're not going out for primary care. We're going for specialized care. The only way we can get that amended is to allow private investment.
Right, and well, we always talk about, PPP, the public-private partnership, and all that. There's some form of this kind of, involvement here in Nigeria, but is it really a thriving industry? As in, do you see this as the perfect environment for private investment to thrive in, looking at the enormous challenges?
God knows. Let me give you as an example. I have been coming to Nigeria every two weeks. Just two weeks. Think about that. And I have a primary clinic that, unfortunately, I focus only on men. It's been thriving. I cannot handle the load. So if we look at sheer numbers and the need, and to completely add that to the fact that we don't have enough doctors, and the fact that we are focused with a lot of chronic issues, the likes of high blood pressure, diabetes, stroke, heart attack, this is a fertile ground. All we need is another environment. So I went out looking to the banks to expand my present clinic because the need is there. I cannot pay 27% interest loan. It's not sustainable because there's no way to magically make that. So if the government steps in with any kind of healthcare targeted fund, we're not asking for free. Cap the interest rate. Developed countries do that. They do that for teachers. They do that for sectors where they know is lacking.
It's critical.
It's critical. Because if we don't pay the price now, we pay invaluable lives lost. And when we are exporting dollars in terms of medical tourism, there's no way we're getting that back. And we have tons of Nigerian doctors abroad willing to come home.
Wow. Willing to come home.
Willing to come home.
And we have another ton from home willing to leave. What an irony. No, but these are the realities anyway. It's more serious. It's really serious. But we have seen the list of nominees that the president has sent to the Senate. And, of course, portfolios were not attached to the names. But by profession, if you read the background of some of them are medical doctors by profession. And in their own respect, they're qualified people. It depends now, it behoves the president to do who to become what by the time they're screened. But if we have to set agenda looking forward to what kind of minister should mount the Ministry of Health, considering the challenges that you were talking about, what should we be looking at? What should Nigerians be expecting?
Doctors are not good administrators. I will be looking for a good administrator, a good technocrat, because this is a major one. So we need someone that can bring the private, the finance part, and look at the epidemiology. We're having a lot of, you talked about the child mortality rate, that's huge. So we need someone that has the ability to manage what the healthcare need of reality is and how to get it funded.
So not necessarily that medical doctor who is going to be in the hospitals.
Absolutely. Doctors are, we're not good managers. We know how to do the injection, we know how to diagnose and all that, but we need a good technocrat because this is a major industry.
Yeah, if you're talking about technocrat, is technocrat in health or technocrat generally who can do business or who can merge private sector, public sector, that thing?
A good technocrat that can merge all this. These are big variables, and these are big variables with big egos. So you need someone that knows what he or she is doing, that says, look, we need this, and as a corporate social responsibility, we need to take care of this. So bring it together because finance is it. And the reality is healthcare, the rest of the world is a business. There is a component of it that drags us morally, that we need to take care of all this, but it's very expensive. We cannot and we should not expect the government to carry the load alone. So we need someone, a good technocrat that knows how to manage and knows how to keep the books going because we need to be able to prepare for years, for decades to come. We're not looking for just a short fix. We need someone that knows what they're doing. Be it a doctor, good.
Right. And looking at the lineup so far, we have a former Minister of State for Health. We also have a former Commissioner of Health. Of course, that's what we know so far. And looking at these names again, they are also reputable. They are notable names with considerable experience. But how much of that do you think we need? Looking at these are recurrent problems. We're even living in the times of the resident doctors, on strike. And so what are your expectations in this regards that perhaps whoever comes on board as substantive and maybe a supporting minister has to be somebody who has been there, who has walked, these familiar corridors and perhaps would, be able to tackle these issues better?
No, that's very, very important. We need someone, this is not the time to bring an outsider who's a novice. We need someone in the trenches, someone who really understands the laid out. Yes, the resident doctors is one arm. We're talking about private sector. We're talking about the current managers of our family health care, the FMCs, the health centers. So we need someone already in there and that has the gravitas to be able to bring everybody to the table. This is not where one side must win, everybody. There's not going to be a win-win situation, because you are trying to bring a lot of fragmented areas. They've never been brought together before. So you need someone that has, basically, he has the clout of the government. The president hopefully will endorse that person and say, look, go ahead, this is our agenda, because it's a big issue. And if we don't tackle it now, it may bring the whole economy down.
Well, it's still just striking my mind when you say, well, medical doctors are not necessarily good administrators in that sense. That is not to say a lot of them are not good. A lot of them are, in fact, under late Professor Oliko Iransom Kuti, that was the peak of the time that Nigeria had the best healthcare when we measured them back to back from independence until now, when he focused on the primary healthcare at that time. But let's talk about the issue of, you cited instance of Washington earlier. Now, we're talking of a hospital that does everything that can. what would it take to have that kind of an arrangement where you walk into a hospital, you know that if you have cancer, there's an area, you have whatever, there's an area, so that when you walk in, psychologically, you know that these people can attend to me. In fact, with that alone, the healing process has started already.
That is a major one, because if you look at the trend from developed countries now, they're looking for what is called a one-stop shop. I come in, because the fear for us in the medical profession is I don't want to lose my patients. When I have to send you to A to go and get an X-ray done, and I have to send you to another place to get an MRI done, considering the situation in Nigeria, finances and all that, the patient may not follow up. But let's think about it. This will be wishful thinking if we can get it done here. It's a one-stop place. We need government backing. We need private sector to come in. It could be a regional section. So region for Southwest, we may have 1 or 2 of such hospitals. Of course, because we are afraid of them being overwhelmed, so we're still going to need pockets of tertiary care area that could be referring patients to this place. But that is the dream. That would be the mecca of all medical professionals, where you come in, no matter what you're coming for, that specialist is in-house. You don't need to go anywhere. And the psychological impact will be better, not to talk about the cost. We waste money when we are sending patients here and there, and we waste lives. We waste valuable time. But if you can have it done under one roof, and trust me, I believe this administration has what it takes.
All right. What do you think of all right.
Before you go, you asked a question. Let's go on a short break, and then we'll come back on this, because Nigerians are really interested in, when it comes to health. They say health is wealth.
Health is wealth.
That's how it goes.
Yes, I wanted to ask Dr. Abbas about our current framework of health insurance policy, because that is something that many people have called a revolution. But here in the Nigerian experience, not many people feel they've been well served on the part of the companies concerned, on the part of government, on the part of the hospitals themselves. So looking at, where you are from, the American experience, and where the potential that Nigeria is yet to tap from in this issue of health insurance. What do you think?
No, that's another angle to look at it. So based in Washington, D.C., it's an hybrid where employment-based insurances. So the goal is you get a lot of people employed and the private companies can provide insurances. And then you have an hybrid of, if you're in a low socioeconomic level, the government comes in with what is called Medicaid. There is Medicaid in U.S. and Medicare. Medicare you get as a result of your length of years of working, whether private or as a civil servant. Medicaid, as the word implies, the government is caring for you, whether for lack of whatever reasons you find yourself in that trench. Disability, medical condition. For example, dialysis, all dialysis patients in the U.S. are paid for by the government. Wow. Whether you can afford it or not is under Medicaid. So now let's bring that to Lagos, or let's bring it to Nigeria. We need an hybrid system. Again, I feel strongly, it's my personal opinion, I don't think the government alone can fund it. We cannot do the NHS of England, we cannot do the NHS of Canada. There's training. So let's do an hybrid. I advocate for a mixture of those, where government comes in, whether because of disability or because of a particular pressing issue. In this case, we're spending a lot of money on specialized care. 2 billion and up, going up for foreign money. It's not coming back to us. A lot of times our people...
It's gone.
It's gone, it's gone. A lot of times our patients come back in body bags. So it's about time we face reality. If we can have a blend, an hybrid. Government will still be taking care of little kids. You know, in the US, you have a baby, it's government care. Government even provides you some milk, whether you can afford it or not. It's basic, it's been passed into the law. That's where we need the policy. And then when you are elderly, 65 and above or whatever the age the government determines, we know you are no longer productive, but you've been productive once before. So government needs to be able to bring you back in. And then we want the private sector to put in. So, the likes of the big companies, they hire you, then you have some form of insurance.
Talking about this private sector, because the way businessmen think is the issue of meeting a need somewhere where you know something is lacking. But we have been talking about inadequacies in the health sector all the while in Nigeria. Isn't that a good enough, reason why a private sector will say, okay, let me move into the health sector and invest there? Because, one way or the other, even if you're seeing it from the business perspective, it's still lucrative.
Absolutely. And let me tell you, from my own angle as a private medical person, the issue is financing.
Okay.
My clinic has been in existence for 4 years. We're thriving. We need to expand. The banks are ready. They've given us term sheets, but they're asking for 27% interest rate. It's not sustainable. So if you're expecting a foreign private investor to come and take a chance, it's difficult. I have a skin in the game. I'm a Nigerian. I want to be home. And there are other Nigerian doctors abroad that wants to be home. But we need that soft landing. We're not asking for 0%. No, the government can cap the interest rate, 9, 10. It's doable. 27%, 20% is not doable because we're not manufacturing. We're taking care. There's a part of you that has to be compassionate. There will be free care that will be done. And when government steps in, then government can have a say. Because that happens also in the US, where you're getting government taxes, the government can tell you how much you can charge the underserved. The government can tell you where to expand. Let the free market play.
And, amidst all of this, I also want you to, kind of clarify or, proffer solutions to the issue of brain drain. You've spoken about it. Nigerians, Nigerian professionals here who are eyeing the abroad, and there are people there who want to return home, but economic factors necessitate that they travel for greener pastures, and so many solutions have been made here. Some say, and that costs a major uproar. Let all the professionals within their first 5 years of graduation stay back home compulsorily. And that cost, so much, backlash. And there has been so much here and there. But, from your, standpoint, what do you think is the way to go? Because we will always have people traveling, for economic reasons.
And personally, from, someone that grew up here and went abroad for over 3 decades now, I think the grass is always greener on the other side until you actually know. What I'm employing our government to do is let's try to make the grass a little greener on this side. Our doctors, a lot of them who were, jackpotting, getting out, is because they were overwhelmed. They actually had no hope in the system here. It's like sending them to the battlefront and having their hands tied. So it's not possible. And there's no way any government in the world can stop its people from migrating. So what we need to do is let's look, what is it they're going there for? We're not going to become an American society overnight, but yes, there might be mixture of opportunities or solutions. The issue of trying to put a timeline once you graduate because the government has funded your education, that makes sense. We're not saying it has to be permanent, but if you make the condition a lot better here, you'll be surprised. A lot of the Nigerian doctors that were migrating, they are not able to practice over there. So
that's the downside. That's a reality.
That's the reality. They are not able to practice over there.
Why?
I'm involved because they have to take a lot of strenuous examinations. They have a 10-year window to take a 4-step exam. You'll be surprised. Over 50% of them do not pass the exam. So we need to look back inwards and say, why are these people living? Why? Because a lot of them have to uproot their family, and some of them will give you the excuse they're doing it for their kids' sake. So if we look at that, we might need to piece it down and break it down into phases and see where are they moving. The financial one is there because they know they get more money over there because the US needs doctors. The UK need doctors. The Canadians need doctors. So why are we training them for free?
You talk about the 4-level test for anyone who is coming. We assume that in the medical profession there are benchmarks where you have to meet before you can practice and so on. Now, what is that extra thing, either in the US or any of those climes, that makes someone who is qualified, certified from a Nigerian environment, that doesn't make him meet up? What's that extra thing?
So the truth of the matter is our curriculum here has not changed in decades. And these are countries where they're on rapid speed in terms of curriculum and meeting their population demands. In the US, you have to take the United States Medical Exam Board, which is USMLE, step 1, 2, and 3, in order to show that you're actually qualified. Not only that, the last set of exams, you need to be very familiar with the laws, and you need to be familiar with what are the patient requirements there. What the American patient needs might be slightly different from what the Nigerian patient needs. And so these are exams that are tough. And our curriculum, like I said, I went through 8 years of medical training with the best of the best. We were talking Nobel winners. Clinical exposure is there. We're lacking here. When I was in medical school, my first 2 years with a dead body, I had only one person to share the dead body with me. You want to take a guess how many Nigerian students share dead bodies? Over 20. It's not possible. And that is where the private sector needs to come in also. A lot of the medical schools in America, they are not government owned. These are private. And so they invest. Of course, it comes at a price. And what the government did for me as an American citizen when I got the admission was to guarantee my student loan. So if the government did that, it comes at a price. So I cannot just jackpot, even if another country is offering me more money. Because I've been bailed out by a government that felt like, okay, we need future doctors, so let's invest. So if we do that, we're investing and we're paying down the road.
Wow. And attached to all of this, again, is welfare. Still on the subject of strike, of industrial actions, there's still a large crop of Nigerians who feel the doctors are asking for too much. But, we've listened to them over and over, speak about how specialized their industry is, how that, okay, even at this time of fuel subsidy removal, while, people in other professions are finding a leeway around it, it's not like that for them because they still have to work, overtime and all that. And again, there's the issue of empathy and professionalism of doctors in this climb. But from your own standpoint, again, are we being fair to the doctors, or are they asking for too much in this part of the world?
Well, as a physician, and I'm not trying to be biased, it's just that we put our doctors in a tough situation. So let's put aside their requirements for one. Let's look at the support system. Are we giving them even enough support? How many nurses do we have for each doctor that is practicing? If you and I walk over to Ikeja, Lasucom now, you see it's a glaring shortage. And what does this translate to? Poor patient care. Because when you expect one consultant to see over 100 people a day, and he or she has only one nurse to help, that's a recipe for failure. So yes, the doctors may be striking now, which if you look at it ethically, it's even against our profession because they're not going to be able to walk away from a patient that needs them. But the doctors are also, they are micro component of another family. They need something to provide for their family. They've invested all these years in medical education. So all we're asking for, from my angle, it's a little bit. Meet them halfway. And if you meet them halfway, talking about the type of caliber of a minister, you need someone that has the government backing and know what's at stake. Because it's not just about what the doctors are asking for. It's not about them just jackpotting. We're talking about patients' life lost. We're talking about quality life lost. And so we can fix this.
All right, let's talk a little bit before we go about primary health care. What we understand is that a lot of the things people take to teaching hospital are some of the things that could have been handled at the level of primary health care or left to degenerate, that could have been handled at the level of primary health care and then nothing happened and then, there are layers, primary, secondary, before tertiary. A lot of our people may not necessarily understand that, there are ailments that fall in different categories and all of that. But the government, from the report we got, that they'll be investing in at least the primary health care per ward in every local government and all of that. It's really ambitious. But we've had it before. It's not like it's not anything new. But how would that contribute to the kind of health care that everybody is looking forward to?
That's a good point. So I believe strongly that we're cutting and pasting. But let's go back to the genesis of all this. So for example, in the US, we have the situation of a primary health care. We have emergency care. The goal of a provider, a medical provider, is to reduce the number of his or her patients that end up in emergency. Anywhere in the world, the more people that end up in emergency, the more will likely die. So your goal as a provider is reduce the number that goes from primary care to emergency. There is a gap missing there. That is the urgent care. We don't have it here. Where, your primary care is, I don't have to have headache. I have to have a doctor that I go to, maybe annually for normal checkup before something bad comes out. But in the interim, maybe on a weekend, if I develop an headache, do I go to the emergency room? No, if I do that, I'm going to overwhelm that system. I need to go to an urgent care. So our government is missing. The idea of primary care is fantastic, but let's do it the right way. There has to be primary care, urgent care, and emergency. When you go through that three-legged stool, you're going to protect your system. And all we need is good institution.
All All right, good to know. And I wonder, your name can still be on the list.
With all he said.
Dr. Rasheed Abati, Chief Medical Director, Heritage Men's Clinic, thank you so much for talking to us, and thanks
Thank
for
you
the
very much.
insight and all of those things. I hope that the government has a very robust plan, that is in tune with this as a way of turning things around. Thank you very much.
Thank you so much
Thank
for
you.
having me.
Great.